Nearly half of your body mass consists of one primary type of tissue, muscle tissue. When you think of muscles, you likely think of the biceps of a weightlifter, but muscle tissue is also found in many other areas of the body, including the walls of the heart and stomach. There are three types of muscle tissue: skeletal, cardiac, and smooth muscle tissue. Skeletal muscle tissue forms skeletal muscles that attach to joints and bones and are responsible for overall body mobility. As a clinician, it's very important that you have a solid understanding of muscle tissue so that you can properly treat your patients with tissue and muscle injuries. For example, many patients pull or strain their muscles while playing sports. A strained muscle occurs when the muscle has been excessively stretched or possibly torn due to overuse of the muscle. The injured muscle becomes painfully inflamed and surrounding joints are usually immobilized. As a healthcare professional, you will need to know how to treat these types of injuries. The standard treatment, known by the acronym RICE, which stands for rest, ice, compression, and elevation. This treatment helps relieve a patient's pain and decrease inflammation. A thorough understanding of skeletal muscle tissue will enable you to help patients recover from painful muscle injuries.